I'm Nick Kelley. I'm the Public Health Administrator for the City of Bloomington, which also serves the cities of Edina and Richfield.
Effective today, Dr. Nicholas Kelley is our permanent Public Health Administrator. So congratulations to Nick.
I was appointed the acting Public Health Administrator in October of last year and had been heavily involved in a lot of our leadership work as the Assistant Public Health Administrator for the last over 5 years at that point. It's a bit of a transition dropping the acting, a lot of doing the same work that I have been doing and then getting the opportunity to help lead our division out of this pandemic and into what the future of public health looks like. I kind of grew up in a family that always knew I was going to have a little bit more of that service structure. My brother, he's a lieutenant in a fire service out in Colorado. He's a third-generation firefighter. My grandfather was a fire chief. My mom's was a special ed school teacher. So going into some sort of service, taking care of your community was something that I kind of grew up anticipating. I discovered Sinclair Lewis's Aerosmith as a young kid and just fascinated by Particle X and the ability for it to treat infections, and just been fascinated by how infectious diseases changed history, the way society adapted to plague and other infectious diseases. We saw dramatic shifts in how society was structured. Buildings were modified and done to allow for that open air after 1918, when we had what was commonly called the Spanish influenza here in the US and globally. This was a tie that I got in grad school. I did a lot of my work on influenza. So it's actually an electron micrograph of influenza, what the virus looks like. I wore this a lot. It's a great opportunity to talk about the benefits of flu vaccines and the impact of influenza has in the community. I went to the University of Minnesota School of Public Health, got my Master of Science and then a PhD in environmental health with an emphasis in infectious disease, working with Dr. Michael Ostrom. We did a lot of different work on pandemic preparedness, infectious disease threats, and that allowed me to understand the role of local government, because you can do things at the national or international level, but the implementation is at the local level. July 2015 is when I was hired to work for the city, but prior to that I was an advisory board of health provider member for about almost a year and a half, where I was able as a resident to be serving on the advisory board of health, working on public health issues.
Our first meeting of every month, we invite in Dr. Nick Kelley from Public Health to come and give us an update on COVID here in the city of Bloomington.
The pandemic has really shown a spotlight on public health, and public health, we've been there all along. We often operate in those shadows, doing things behind the scenes, and would talk about we're the best kept secret because you don't know about public health until something bad happens or you needed our services. And so we've been that safety net, that structure behind the scenes, helping people live safe and healthy lives for a long time. We've been doing that here in Bloomington since the city was incorporated. There was a whole lot of things that shifted, and it was that scary personally and professional of I don't know what this is going to do. How's this going to impact the world, my family, my community? How do you do your best job to keep the 180,000 people we're responsible for healthy and safe? I think, some of the things that keep you motivated is the kids are just amazing. One night I remember I was just so tired and had been working really closely with our school partners and just on so many other issues of trying to get things to be functional. And he drew me a little picture and said, thanks for working so hard so I can go to school. So I think one of the biggest challenges public health has in the next 6 months is going to be this transition and adjusting to what do we do as COVID becomes more of an endemic disease, something that's a steady baseline in our community versus this pandemic where we see waves of infection, and dealing with those inequalities. So one of the things that was front and center with COVID is we saw some populations and some communities disproportionately impacted consistently, especially our BIPOC community, and we also saw it with our older adults. These are things that we talked about a lot before the pandemic occurred. They're both impacted by what we look at as social determinants of health, the factors that impact how you live, work, and play in the community. vaccines are our exit strategy. That's how we're going to get out of this pandemic. And to see we're approaching 18,000 doses our staff have done in the community. Most of those are incredibly targeted to certain jobs or workplaces or our BIPOC community. And knowing that we've been part of that turning the tide. Many parts of Bloomington are well over 70% of the eligible population with their first dose. And there's parts that we're working really, really hard with community partners and our staff to get them to that 70% threshold. It really just makes you just incredibly proud that we're helping accelerate that path to that light at the end of the tunnel and getting us back to something that's more normal.